So today I want to talk about the differences in diagnosis and management of the coronavirus and why that process just seems like it's not clear cut, and why sometimes it's maybe different for everyone, and you might find that we test some people but not others. So let me just go through why that is the case. First, the clear reasons for testing someone are going to be people that have symptoms that include cough, congestion, sore throat, loss of sense of smell or taste, fever or chills, and they've been exposed to someone that was positive. So someone like that, clearly we would want to send them to get tested to further know what the procedure will be as far as how we manage their symptoms, but also how we can help isolate them and prevent further spread. Other not so common reasons for testing or maybe withholding testing would include and maybe just let me just give an example. Let's say you are exposed to someone who has a family member that tested positive in their home, but that person doesn't have symptoms yet, and you don't have any symptoms. Should you go get tested? Well, that's a good question. But sometimes it might be better to just wait and see if that person that was primarily exposed comes back positive. And in the meantime, properly isolate yourself and watch for any symptoms that might develop, and just wait to see if that person becomes positive or negative. Okay, what are some other factors that might determine whether someone will get tested or not? Well, we got to think about their living situation, their ability to isolate at home. We got to think about the type of work they do and the potential for exposing other coworkers, the proximity to other coworkers, whether they are first responders or not, their own immune system, but also their family members' immune system. So this is just to give you examples of some factors that play into the decision of testing people. Okay, so let's talk about the tests that we have. So the most common test that we will be sending out when we are diagnosing someone with coronavirus disease is called a nasopharyngeal swab. Okay, it's essentially a collection of secretions that are present in the back of the nose or the throat area. And it's intended to analyze for the genetic parts of the virus, of the coronavirus, and or essentially kind of like their fingerprints to see if they're available or not. So that test is very helpful when it comes back positive. It's pretty accurate as to determining that somebody has the infection and has been exposed. If it comes back negative, there are some limitations there. And then that's when we start seeing what we call a false negative result. What that means is somebody might have a negative test, but they may still be positive, or they might become positive in the future. Okay, that statement alone should tell you kind of like why that is the case, why they test negative. So if you think about the swab that we are collecting, to collect the secretions, that's done in a particular moment in time, and that's at that moment is when we are looking to see if that test was positive or negative. If the genetic material of the virus is not present in the secretions at that particular moment the swab was collected, that test will come back negative. The person may have symptoms later on, or they may not have symptoms, but the virus may be more present in terms of its genetic material. and the secretions later on, and it might test positive later on. Other factors that can make this test become falsely negative, maybe the way it was collected, maybe the way it was processed, but it brings it to a rate that we have seen up to 30% false negative rate. Okay, and we know that based on studies that were done on the COVID testing in China. We don't have enough data in the US to compare to see if that rate is truly as high as it is, but it's just something to keep in the back of our mind when we're looking at this test and it comes back negative. The other type of test that we have is a test that doesn't look for the virus, but looks for the body's immune response to the virus. Okay, that test will check for certain things the body develops called the antibody. Okay, and it's essentially the body's way to respond or kill the virus. Some people may develop that early on in the infection. Some people may never develop the antibodies right away, and it might take several weeks for that. But that specific test is used to identify if somebody had a recent infection or if somebody had a past infection of the coronavirus. It also helps us understand how the human body's immune response behaves if that same person were to get exposed to the coronavirus a second time, to see if potentially they might have less symptoms, or they may have symptoms that are very similar to their initial symptoms. So that's again the second test. It's not a test that is used alone to diagnose, but it's used to support the diagnosis of coronavirus disease. The main test is going to remain the nasopharyngeal swab, or the swab that collects secretions from the back of the nose and or the throat area. Okay, so if the process is not so clear and we have a false negative rate up to 30%, then why do we test? Well, it's a very good question, but just to kind of simplify a little bit, well, we test because when it's positive, we know that someone has the infection, and we can immediately isolate them and start tracing where they could have been, where they may have come in contact with, and other people that may be exposed. When it's negative, based on the situation and the certain factors that we talked about, we can further guide them as to what to do as far as isolation and the time that they would need to isolate to reduce the risk of exposures to others, but also potentially for them, to develop symptoms later on after the test results are obtained. So that's really it that I wanted to talk about as far as why the testing process may not seem so clear cut, but one thing remains that we know about how to prevent this. And one question that comes up, especially during this time that we're starting to reopen business, is who should be wearing masks now that we're out in the community? There's not a perfect answer to that, but I will tell you a lot more people should be wearing masks than we're currently seeing. Okay, reason being, as we know, how the virus spreads, it's going to be through sustained exposure. Okay, at least 15 minutes of exposure to someone that is less than 6 feet in proximity. So if you're going to be around someone, you don't know if they're about to get the infection. You don't know if they're maybe they don't have symptoms yet, but you want to protect yourself. You want to protect them in case you're going through that same situation and you're carrying the infection but don't know that you're able to spread it. And you also want to protect their family and your own family. So goes back to the basics. Wearing our masks when we're out in the community would be a very good idea. Washing our hands and hoping that we can get through this together. I know it's not a simple process, or maybe just seems a little confusing at times. But I just want to encourage you to reach out if you were to have any questions about how to navigate through this, or how to go about protecting your family or protecting yourself or your coworkers, or what to do if you have any symptoms that may resemble coronavirus, but you're just not sure if you should get tested or not. So please stay well, and let us know if we can help in any way. Thanks.